and thank you for tuning in. I'm Dr. Mark Tam, hair transplant doctor. We're here on Harley Street Clinic and talk about all things hair. Today with me, in the podcast, we have Sunil. Welcome, Sunil.
Thank you very much.
Thanks for joining. And we've been talking about hair for a long time, and I know Sunil professionally. And so, Sunil, just tell us a little bit about yourself and about your work that you do for, I know the amazing work you do for my patients. So if you're my patient, you probably already know Sunil through me. But please, Sunil.
No, thank you. Thank you for inviting me to the podcast. I appreciate it. So I'm a pharmacist, community pharmacist by background. And then I suffered hair loss myself and went through the journey. So I understand as a patient how it feels. Found traditionally I was using Minoxidil for many years, didn't really see much growth and wanted to find out why. And then did that kind of research for myself and eventually found the secret sauce, which is personalizing. So everyone's hair loss is different. And rather than just getting off the shelf is to create, compounded personalized treatments. And that's what I did for myself. And once I did that for myself, I wanted to share it with others. And that's how we created the brand Growback. And why we joined forces to help your patients.
Oh, that's awesome. In fact, that is probably one of the most common questions, not necessarily a question, but most common comment that I get from my patient who say, Doc, you know what, I've been using Minoxidil for so long, I'm not sure if it works, and it used to work for a while, and then it kind of stopped. Why do they get what is that? Because the medication they were using is wrong, or they're just not responding to it, or what is it?
Well, there's several reasons for this, and I think initially it's whether Minoxidil is the right thing for them, and if it was working, the reason where it may have stopped could be several reasons. One, they may not be using it properly. Don't forget, people are aging as well. So hair loss is happening at the same time.
That's me.
and they forget that as each year goes on, natural hair loss is happening. So we need to adapt treatments. And hence why we do personalized treatments and we have regular contact with patients. Depending on year or a few years, things will change. Minoxidil and Finasteride are the most common things that are out there in the industry.
Yeah.
But those two aren't the only molecules or actives that can be used for hair loss. There's several others. We have an umbrella of about 20 to 30 different molecules that we use.
30 molecules.
Yeah, and they the key thing is you've got DHT being the most common cause for miniaturization. Then you've got something called prostaglandins. Prostaglandins are biochemicals that surround the hair follicle. And that determines whether your hair follicle is in the growth phase or in the shedding phase.
Okay.
Minoxidil is a prostaglandin E kind of activator, and that helps with thickening the hair. Finasteride and Minoxidil are the ones licensed. The other ones are unlicensed. So we're dealing with medication unlicensed for hair loss, but they control this whole prostaglandin link. So depending on your prostaglandin, which one you're overproducing or underproducing will depend whether Minoxidil will be the right thing for you.
So can you just tell by looking at it? How can you tell?
There's no way of telling just by looking. You can talk to people about their history, but what we have now and what we have in our own brand is a DNA test that tells us which prostaglandin you're overproducing and underproducing. So this is the TRICHO DNA hair loss test that we do in Growback.
Cool.
That gives us even more information about someone's growth factors. Are they producing enough growth factors to help with hair growth? Also, things like collagen synthesis, because when you eat protein, you have to break it to amino acids. The amino acids have to rebuild back into protein, and our hair is all protein-based. So you wouldn't know whether you are able to do that collagen synthesis. So hence why we need this kind of test.
So the test can tell?
The test tells. DNA is the programming of how your hair follicle is made. So that programming or the coding is the information that I need to be able to personalize a treatment for you.
So going back just now, the Minoxidil, you mean, Minoxidil and Finasteride has been in the market as the FDA approved medication for so many years. You mean it can be, people can take this medication, doesn't work for them?
Yeah, so it will work probably about 60% of the population. The 40% it may not work for. So Finasteride and Minoxidil have years of clinical backing, and that's why they're licensed. There's lots of actives now that are up and coming, and they are going through their own licensing process now. However, they're only touching little parts of why the hair loss is happening. So finasteride is a 5-alpha reductase inhibitor, but it will only inhibit type 2, where the newer generation 1 dutasteride will be affecting both type 1 and type 2. But you don't know which one of those enzymes are the reason that you're having the rise of DHT or dihydrotestosterone. But again, the testing tells us which one of those is the one that's affecting your hair follicle. But the reason it doesn't work for everyone, especially with minoxidil, is this whole prostaglandin, kind of balancing. So you've got three main ones: D, E, and F.
D, E, and F. Okay.
Yeah. So prostaglandin E is where minoxidil works. Prostaglandin D is what causes the shedding. Prostaglandin F is the length of the hair shaft.
Okay.
And if you have an imbalance of this, that's when you have hair thinning, hair loss. So if you have a lot of prostaglandin D, you're shedding lots of hair. So your hair cycle is reducing. The hair follicle, or the follicle only has a certain amount of life. So we rotate probably 30 times the cycle of the hair follicle, and then it disappears. It miniaturizes and then disappears. But if your cycles are shorter, those 30 cycles are going to happen sooner in your lifetime. But what my aim is to extend that lifespan of the hair. So then those 30 times could last 60 years rather than 25 years.
Cool.
But it's prostaglandins that actually control that.
Wow. That's some deep understanding of that, Sunil.
I just launched my own YouTube channel, and I've actually done a video explaining the prostaglandin, and it's good because I need patients to understand why some medication are working for them and why some aren't. And once they have the DNA profiling done, they then understand the DNA profile further. So it gives them a lifetime of education rather than wasting money and buying things off the shelf. They're buying the right things and compounding or personalizing their treatments. Usually with someone who's having general hair loss, the first thing they'll go to is either standard supplements or shampoos.
Yep.
But none of those really work because of the amount of bioavailability they have. So when people are using shampoos, they're not leaving it long enough on the scalp because it takes about 20 minutes to absorb. Most people don't leave shampoo on their
20
hair.
seconds. That's
exactly. So, and most supplements, get destroyed in the stomach, and you're only absorbing about 10 to 15% of what the active is.
What do you mean? You take a supplement and you only get 10% of that?
Yeah. So when you take a supplement, a standard capsule goes through the digestive tract, gets destroyed mainly by the acids in the stomach, and then goes into the small intestine, where majority of the absorption happens into the bloodstream. So normal capsules will just disintegrate in the stomach where the acid is, and then all the actives are destroyed by the acid. Then goes to the small intestine and then absorbed to the bloodstream. By the time that process has happened, majority is destroyed.
Does it mean that we need to take more supplements, Sunil?
No, you need to take the correct supplements.
Oh.
So this is all down to, and being a pharmacist, this is what we focus on, is delivery mechanisms. So there's, you've got, for example, like a painkiller, you've got patches to absorb straight into into the bloodstream. You've got, IM injections, IVs. So the same comes with supplements. You get the right type of casing to hold the actives, and the casing needs to be like a delayed release. So that means it will not get destroyed in the acids of the stomach, but then disintegrates in the small intestine. And we actually have a supplement focused for hair loss and hair rejuvenation and hair health, and it's the TRICHO RX 24.
TRICHO RX 24.
Yeah, the RX is a symbol for prescription. So this is not something that people can just buy. Has to come through a consultation to make sure it goes to the right person, because there's lots of supplements and there's different reasons for why we use supplementation. So a consultation is needed.
Key.
Yeah, it's key because you don't want to just take something, although it's natural and they're herbs. There's still interactions, contraindications. These are things that we need to look out for. But the TRICHO RX 24, I'm really proud of, producing this because it's taken,
How long has it
years,
been?
years of, reading papers. These are science-based active ingredients. And each ingredient is doing a different part of, what the hair follicle needs. DHT blocking, anti-inflammatory. We create a lot of free radicals, and that's RS, which is reactive oxidative stress, which then destroys the hair follicle. But it also ages the hair follicle.
Ages.
Yeah. So your hair follicle is older
Yeah.
than what you are. Yeah. So what we want is antioxidants and things that create longevity for the hair follicle. So these ingredients that have backing behind it, papers, science-based, we've put this into a capsule. And the 24 represents there's 24 ingredients in there.
24 ingredients.
Yeah. Or put in there on purpose to synergize the activity. We even have a probiotic placed in there. So when this capsule disintegrates into the small intestine, it's creating its own microenvironment with probiotics for maximum absorption. So maximum absorption means maximum bioavailability.
That's a lot of thinking into a supplement, Sunil.
Yeah, it's when I sleep at night, this is what I think. I'm sure you do with your hair transplant as well. And with talks with you in the past about your introductory pack and the supplement you give with them, there's reasons why you do
That's
that.
supposed to be secret, Sunil. Well, I guess that people probably watching will know there's no secret that we actually prepare our patients beforehand, and like I told Sunil in the past, we want to optimize the work that we do. We want to control the condition in the best way possible. So those who are looking at doing something for the hair, then supplement is a option, right, Sunil?
Yeah. So supplementation is part of it. There's foundations for hair regrowth, and the foundation is a personalized treatment, which is usually topical. It can be oral, but topical. The reason we go mainly for topical is because we can mix different ingredients, adjust dosages, percentages on there depending on the individual. It's like brushing your teeth. So you keep your teeth healthy by brushing it every day. You keep your hair follicles healthy by applying a treatment.
It's interesting you mentioned that, because you go to dentists and they expect you to be brushing your teeth and flossing your teeth and doing all sort of care for the teeth, and you go to the hair doctors or the hair pharmacists and you ask them, do you do anything? No, I don't do anything. It's like this, and so. But I was just going to talk a little bit about, you mentioned earlier on the topicals. It's hugely popular. It feels like that's the latest thing. I mean, I'm in the industry, so I know topical has been around for a good few years now. And just talk us through about these topical medications.
Yeah, so topical has been around for many years, and minoxidil is how it came out as a topical initially, but now you have finasteride, dutasteride, all as topicals, and other ingredients that are there. The reason it's become very popular is it's accessible now, where before it wasn't accessible, maybe through a dermatologist that you could get it, but it's accessible now. But the key thing is that people are going for topicals and maybe harming their hair follicle if they're not having a consultation with someone.
What do you mean harming the hair follicle? I mean, I've got patients who self-medicate using Minoxidil and Finasteride. You mean this is harming?
Well, they are. These are medication. We're dealing with pharmaceutical ingredients. So they are side effects. They're contraindications. There's different elements to each ingredient. So as a prescriber, I need to understand that person, make sure their health is in the right place, the medication are correct. Finasteride, and it's been lately in the news about, kind of mood alterations, people feeling suicidal with them. If you're not having regular consultations, you don't know as a patient, as a layperson, whether it's a side effect or just how you're feeling. So medications do have an effect on the body, on what we call systemic, through the rest of the body. Even though you're applying it topically, it's still going through the bloodstream. So coming back to the question, why is it popular? It's convenient. And a lot of patients, when they think of topical, they don't think of it as medication.
Yeah, in a way. I mean, the way the market now is, you see in the advertisement every time you turn on the telly, and it's like topical and mix, sign up and subscribe to to this package, and a lot of people think they're doing the right thing. What you got to say to them?
Yeah, I think, and again, we spoke about prostaglandins, and if they're not going for the right ingredients, they're not getting the right treatment. They're going to waste their time, their money, and as time goes on, you're getting less and less chance to regrow your hair, because of the miniaturization process. My to anyone who's listening out there is prevention is the best thing to do. So if you know in your family, if you have the genetic hair loss that you see your brothers, your father, or your uncles, and your nephews all suffering as a male patient, and with women, if they see their mums through menopause and they're getting thin hair, start before that process happens. Because we want that hair length cycle, and we only have 30 lives in each follicle. If you use them up too quickly, once a follicle's gone, there's really nothing that I can do for them. And this is probably where you come in. Once a follicle's gone, they would need alternative types of treatments. However, when they do, for example, get a hair transplant, what patients seem to think is once they've had a hair transplant, they don't need to do anything. But once they've had a hair transplant, the rest of the hair, which is the native hair, which hasn't been touched, still needs to continue to have that growth to match the hair transplant. So we want, full coverage, full density for as long as we can. And if they're not doing treatments, it's not going to happen.
Absolutely. I mean, you just nailed it right there. I mean, people think having a hair transplant can solve the issue. I mean, you can solve the receding look. That's the area that they already have lost the cycles already in there, so they've receded, so there's no hair in the area. Well, transplant is obviously a very workable option, but that doesn't cure. I always tell my patients it doesn't cure the conditions. The condition is still there. You can continue to recede. And actually, I think you just said it right there. And if someone had a hair transplant to fix their hairline, so we're going to transplant it in the front, and then it opens up an opportunity to if they lose more hair, then they just make themselves having the need of having more transplant, and I think a lot of them don't realize that the importance of that, and the time that is even more important to look after it in the best way possible.
Yeah, when a hair transplant is certainly the biggest confidence boost anyone can get. I've seen we've seen some of your patients before the transplant to build as much as we can before having a hair transplant, and then seeing them after, and they totally transform. The work that you do, they see more immediate results. Where the work that I do, they have to wait 6 months before they appreciate the work that I've done for them. So for me, it's a very much a hand-holding process where I have regular consultations with them. And again, ingredients like minoxidil initially will cause hair shedding before the hair growth. So that hair shedding sometimes puts patients off, or when they're applying the topical and they've gone 2 months into the minoxidil or an ingredient that causes shedding, they think they're causing more hair loss. And that is a scare for them, and they stop using the treatments. So the reason I do regular consultations is to make sure they understand this is normal. This is the way the process goes.
And that's what you don't get if you just subscribe online on a very beautiful looking website, and where they just get the medications, and
and the one thing that worries me a lot about form filling and online purchases of medication is that form doesn't understand you as a person. Even though we have the DNA testing and we've got sophisticated systems to tell us about your hair loss, again, there's something about that individual that you need to understand to whether will they use topicals, will they use it regular, because treatments will only work if they're consistent with using
compliance, right?
So it's having that chat with them to what to expect, what not to expect. And again, when you do these online kind of forms, and you get, it's not everyone that does it, but majority have 6 month, 1 year packages, where with the way we work on a monthly or 2 monthly basis. And the reason for that, and the reason we have the DNA testing, is because we've got vast amount of data about that patient. If they're going through a stressful event, they may need a different ingredient to add into the topical.
Oh wow!
Or
So you can
have
just
separate.
customize it to that level.
To that level, yeah. So and you've got patients with other issues, so autoimmune issues. You've got patients with eczema, bits and pieces that may contribute to the hair loss. So then we can then tailor or tweak the treatment. So if someone's having a flare up of stress that triggers their eczema or psoriasis, we can then add in other ingredients. The problem with buying something for 6 months to 12 months in one go is if it's not working or if it's not the right thing for you and you're committed to that, you're wasting that time. Yeah. But at least we can...
That is part of the hair cycle is going thinner. That particular cycle is thinner and thinner, and we are not doing anything to preserve them.
Yeah, but by the time they come to you or myself, they've already lost a lot of hair. That's why they've come to us. And again, I go back to prevention. If people listening out there, they know they may get to that stage or their family go to it, the sooner we start the medication, it delays the kind of the whole process. There's no cure for hair loss. All we can do is delay till they get hair loss. And those cycles that we're talking about, the 30 cycles that a hair follicle has, we want to expand the time till you reach the next cycle. But if people wait, that cycle becomes shorter and shorter, and they're going to lose their hair sooner than expected.
How long does a cycle usually last?
So a cycle for men is shorter, and for women it's a longer cycle. Hence why men, if they try and grow their hair, they'll only grow to the kind of shoulder, where women can grow their hair really long. So an average would be between 2 to say 4 years is an average. But again, with new kind of lifestyle issues, metabolic issues, those cycles are getting shorter and shorter. So again, if you're, like you was talking about your hair transplant patient who's, may not be nourished well, hence why you prep them up. The same, again, with regards to nutrition is key. Nutrition will then allow for that anagen phase, the growth phase, to keep growing. And then the medication that we prescribe and we create for them, the aim is to increase that growth phase and reduce the shedding phase, which means that the hair cycles will last longer and longer. So rather than it lasting 1 year, we may be able to extend it to 3 or 4 years.
That's awesome.
Yeah. So that's my aim. And my aim is to, the outcomes I'm looking for is less shedding, maintaining the hair growth. If we can increase the density or reactivate dormant follicles, because that's happened to us where we've not expected any growth, but then suddenly we get growth in areas where we thought there weren't going to be any growth. But that's because some hair follicles become dormant, they're asleep, and some of our treatments wake them up. We
see that all the time, actually, when someone who comes to us to have their hairline restored, and sometimes they go on some anti-hair loss medication first, and they notice that, I've got a few hairs, spray hair coming, but I think that's is it true that that is the minority of, if the area is receded, then the medications bring back only to a degree, or can be to a bigger degree?
It depends to how much the follicle is miniaturized. So there are different reasons for the hair follicle to go dormant, or if they've miniaturized, and this is the hardest thing to treat. If they've miniaturized too much, what's causing the miniaturization is dihydrotestosterone. What dihydrotestosterone does is increase inflammation. What inflammation will do is destroy things. So that's that cycle, because if they've gone through that and it's miniaturized more than 50%, it's very, very difficult to treat. And this is where time comes in. However, in some patients, the follicle's just gone to sleep. And then the medication's just waking that up.
And that's where you see the hair
goes. Yeah. And again, it's only after kind of 4 to 6 months of using consistent treatment.
Correct.
That
medications.
That they will see that. And, the activity is happening before the 6 months, but it's happening inside the skin. And patients don't see that.
They can't see it.
Yeah. It's only when it pops up and they're like, oh, now I can see little hairs. And, that's how it is. So hence why whenever we have our initial consultation, I like to let my patients know what to expect, how long it will take, the initial shedding phase that will happen. These are things that patients need to understand, because if they fully understand it, they will then understand why they need to be consistent and why they need to wait 6 months.
We got some patients who experience this who use Minoxidil Finasteride or as a combination or individual, and they notice that when I first use it, it seems to work. I keep using it, being consistent, and then seems like it just stopped working. Is that such thing that medications stop working? It sounds like unusual.
So the body is very clever. The body will always try to find equilibrium. So if you're adjusting things, so Minoxidil Finasteride are adjusting how your body is working. What will eventually happen is the body will equalize to that, and then it will maintain. So there is a degree of, in time, you need to tweak things, and sometimes you may need to take a break from the medication to then start again
to get the
to get it going. The other thing is that also from a patient's point of view, they see growth initially. So, where they've had really thin hair and suddenly it's thick.
Yeah.
They're not at that stage, then they're not happy. They want more growth. So it could be a perception from their point of view that they're not seeing the same enhancement that they did initially. But what they're not understanding is it's maintaining their growth. Yeah. So that's what part of the education is that you may not think it's working, but it is working because, when they look in the sink, when they're after a shower, there's not much shedding happening. They're not seeing that. The hair isn't, kind of losing the density, but they get to a state where they expect more and more. So, yes, it will start working initially, get a really good enhancement. Then it's about maintaining that look. And that's key for patients, is to understand that they need to continue medication just to maintain the look.
It's a little bit like after transplant, after a year, the hair got better, and then it stays the same. And then why didn't it got any better, doc? Because it's always growing.
Yeah, but again, for me and you being in office in clinic, we see them in certain time periods. So for us, we say, oh, that's really good. It looks really good. But for them, they're seeing their face every day in the mirror, so that they become they become just adjusted to that look. And then again, there's a rise of kind of mental health and kind of that kind of feeling in hair loss patients, and because they have this phobia about losing hair, any little change, and our hair cycles go through different seasons. Yeah, so in some seasons, you've got good hair. In some seasons, it's just how the body works.
It does vary, right?
Yeah. So, but once they see the mirror, and they see a slight difference, they think they're going to go back. And this is where, why I say the job that I do is very much hand-holding the patient, because there will be times like that.
Cool. Can we have a look at some results, Sunil?
Yeah, so
let's bring some results and have a look what the medications can do to.
We've got so we've got some. So we've actually done a case study with one of your patients.
Really?
Yeah.
Let's have a look.
So it's on our website, and on the website we have a blog called Hair Talk, and I've put a lot of information for patients. You don't need to be my patient. I just want people to be educated and make sure they're going in the right direction. So,
which one was that? What we talk about? The one we.
So this is my journey.
This is your journey. Oh yeah, let's have a look. Oh wow, look at that.
So that's.
So this is before, in 2008.
So this is how I maintained my hair before, and just kind of using standard Minoxidil, some Finasteride. I reacted to Finasteride, so I had to find DHT blockers that would work for me without the side effects.
Oh, wait. You again on that one?
Yeah. So originally, because Finasteride is doing the DHT blocking.
Yeah.
Minoxidil is helping with the thickness of the hair.
So both was working for you at that time?
Yeah. So I was using both.
Yeah.
Got some results, but not great results.
Okay.
Had to stop Finasteride, with some side effects that I was suffering. And then I was trying to find some alternative DHT blockers. And that's when my study on the TRICHO RX 24, that's the journey started then, to find, what that, and then I maintained it to 2008. And that was me just maintaining on regular. once I discovered personalized treatments and did it for myself,
Wow, look at that.
That's, you know,
That's almost like a transplant results.
yeah. So, you know, I'm sure I will have a transplant at some time, and I'll be coming knocking on your door. But again, my whole aim is to see the maximum I can get with medication.
Uh-huh.
Yeah, and a combination treatment. Everything is, you know, in combination is always the best. And we actually did a case study with one of your patients.
Let's have a look.
Let's see if you recognize him. So you can see your drawing on there.
Oh, that's my drawing.
Yeah.
Oh wow! Look at that! Look at that before and after. So much. Thank you. So this is where we help him with the hairline.
Yeah. So you can see your lines for where you've done the transplant, and I think you did some on the crown for this gentleman.
Cool.
And it's about the native hair. So this is your estate, and my estate is the middle bit, and we need to match the real, you know, the expert work that you do.
Oh wow! Thanks.
So you know, and you know, to point out, this is a 2-year journey.
Mm-hmm.
The journey started 6 months before the transplant.
Mm-hmm.
So we had to get some growth before the transplant. Mm-hmm. Like you said, we want, you know, the hair follicle to be at its best health when you're doing the transplant. Mm-hmm. Then post-transplant, we then change the formulation over to look at real growth and to look at density to match, you know, kind of the hair transplant. And this is, you know, he's a different person. His personality's changed, the confidence in him now.
The degree of transformation, I gotta say, this is amazing. How come this is not on my website?
We'll send you. But I've actually written, you know, the blog
on
there.
Cool, awesome.
I need to learn how to use your iPad. There we go. So you know, the kind of the journey that we went through is on there, and even my stories is on there.
Awesome. Wow. For anyone who wants to hear more about Sunil's story, so check out at the growback.co.uk. And thanks for joining us for this episode. We learned a lot of important stuff, and I think the custom medication, I think a lot of patients would benefit from that.
Yeah, I would highly recommend. It's the best investment they can do is to have their DNA profiling, which comes with a consultation with myself. That's the best investment because it will give them lifelong understanding of their hair loss and how they should be treating it.
Awesome. Thank you, Sunil.
I appreciate this. Thank you very much.
You.